Yeah, I got it.
Great. I am calling this meeting to order. This is the Public Safety and Human Services Committee held on Tuesday, March 18th, commencing at 4:32 p.m. All council members are in attendance with Councilmember Stewart and myself, Councilmember Salahuddin online, and myself as the presiding officer. There are 6 items on the agenda, 5 of which are action items, 1 of which is informational only. And we will go ahead and get started with our first item, which is automated speed safety cameras, amended city ordinance, and camera vendor service agreement. We have Chief Lowe. Oh, Deputy Chief Coates is in person, and Chief Lowe is online.
Thank you very much. So the police department is seeking council's approval to proceed with the development of an automated speed camera program and the approval of the amended Redmond Municipal Code 10.25, which governs the automated traffic cameras, and approval of the contract with Nova Global, which was the selected camera vendor to implement the program. We're asking for approval for these 3 items and have it put on the consent agenda for April 1st. And if there's any questions or discussions, we're here to answer them.
Thank you, Chief Lowe. Any questions? I saw Council Vice President Forsyth, then Councilmember Nueva Camina.
Thank you. I saw there was recently a survey that went out online, and I don't feel confident in voting on this prior to getting the results of that community feedback survey. When are we going to see those survey results?
I can answer that. Brian Coates, Deputy Chief of Police. The survey is currently still open. Prior to the meeting, I did ask City Comms for an update on where we are right now with the results coming in. They are still coming in with, this is just hot off the presses, 45.3% supportive or neutral of the cameras, with 54.7% not supportive. And then there's other questions embodied within the survey that goes into how often they travel those roads and that kind of a thing. I don't know when it closes, but that's kind of the halfway mark right now.
Great. I would say that I'm not confident voting on this until we have a chance to review that data from that survey when it comes back. Thanks.
Councilmember Nueva Camina, and then Councilmember Fields.
Thank you, Councilmember Salahuddin. My quick question, one was in reference to the questionnaire that went out. There was, I believe, 2 that was in the memo that came out, and that one was going to be in the spring of 2025. I just want to confirm that that's the one that we're talking about.
It is.
Okay, great. So that answers that first question. And my second question was appreciating that the proposal expands from the school district, from around the schools to later in the park once we have these implemented. And one of the ones that I saw on there, with the assumption that this is to protect pedestrians and also other non-vehicle multimodals, the one that is proposed for some Westlake Sammamish Parkway by Marymore, and wondering how much non-vehicle traffic do we have in that space?
I can attempt to answer that question. You're talking Westlake Sammamish at the entrance to Marymore Park?
Correct.
Yes, there's a bike path along Westlake Sammamish that's frequented by bicyclists who are entering the park, and the trail that goes through the city and out of the city, as well as into the city. There's also a rather obscure, but a bike pedestrian path that comes off the hill down to Westlake Sammamish and about that general area. So it does see a fair amount of bicyclists. If you recall, Northeast 51st and Westlake has a dedicated bike signal at that location because of the pedestrian and bicyclists use that section of roadway.
Great, thanks for the clarification.
Councilmember Fields.
Thank you. So I think I had a series of questions I was going to ask about the survey, like what was the reaction, what were some of the specifics around the reaction, but it sounds I tend to agree with Councilmember Forsyth until we understand what the community's thoughts are, what their input is to us. I'm not prepared to vote for this either, and not only receive the survey, but actually have a chance for council to discuss the results of that survey. One of the things I did hear about the survey, and I'm surprised to hear such a large percentage of people who didn't favor it, is that the survey itself was kind of very much a push. There was very little room to provide comments and very little room to actually disagree with the survey questions. I found that was a few people from our community stated that. So rather than go through the questions I have and try to get answers, I think I'm just going to agree with Councilmember Forsyth.
Council President Kritzer.
Thank you. Apologies, my Teams isn't working, so I'm just going to do the hand raiser. You can see me on the tiny screen. Yeah, I really appreciate having this proposal now written, because I think we've had a couple sessions where we've talked about the idea of this, but actually being able to see the specifics is really helpful. I would say this is a robust amount of information, and I think we probably should, before we would bring this to a vote, would want to schedule a study session just to be able to dig in. Hopefully we could also have the survey results to discuss at that time. As well as just to be able to ask, because I have a couple different questions about some of the specifics in this, and just for the sake of time and committee, I don't know if we want to dig into every piece on it. So that would just be my suggestion, is that I'd be happy to look with Council Vice President Forsyth and the mayor to find some additional time for us to dig into this, hopefully with also discussion on survey results at that time. Is there, I guess one question is whether, is there a time urgency, like a kind of deadline by which we would need to do it to be in place for the school year? For next year, which is, I think, was
Not in urgency, but the further we push it out, that gives us less time to socialize it with the school district community. Ideally, the timeline that we're on would get it up and running, installed, and able to be socialized before the start of the next school year. But we'll take it back and come back to you, and it gets done when it gets done.
great, thank you. Yeah, and I think we could look, we probably hopefully could fit it in within the next month or so for additional discussion. Since we have the materials here, I just don't think, in my opinion, that we have the time to dig in and discuss on some of the different aspects. And it'd be great to also have a little bit of a kind of presentation about what is being proposed, so that we could also refer the public to the specifics of what is being proposed, like what will be done in the near term, what will be done in the future. Obviously, it's in here, but also it'd be nice, because I bet we'll get a lot of questions about this from the public, even given what we're hearing about responses to the survey now, if we decide to proceed, so.
Great, thank you. I have Councilmember Stewart and then Councilmember Anderson.
Thank you so much for the work on this team, and especially the awesome report that comes along with it. I had a question about the effectiveness date of the contract. The date listed on that contract is May 24th. Excuse me, May of 2024. Could we clarify what the date effective of that contract would be? Or would we be okay with an update? Yeah.
Yeah, so I'm sorry. So the contract will be, the effective date will be amended once approved. We've been working on this for quite some time, so this was the original draft of the contract. So I apologize for not catching that date discrepancy, but if approved, then the contract will be amended with an effective date, post-approval.
Okay, thank you. I appreciate that. And that the report included also lists the prior touches to council on this, as well as some of the summary on community feedback to date is on page 25 of the packet. I might differ a little bit from my colleagues here. I think that council, we've had a few touches on this now, and it has felt like a clear direction, and in good concert with our Safe Streets for All work as well. So as far as the ordinance goes to include parks, I'm a huge thumbs up. I thank you, Chief, for your response to some of the feedback I sent over just regarding a quick language change on the report. And when the council is ready, I'm prepared to support this program. Thank you.
Thank you.
Great. Councilmember Anderson.
Quickly, could you review for us the sole source background on this item?
Yeah, just in short, Nova Global has the ability to, I'll say, modulate the volume of tickets so as not to overwhelm the actual process with the court. Additionally, they have the ability, or they will actually verify that school is in session when citations are issued, so as to not, I'll say, create any unnecessary hardship. So if for some reason, say there was a weather-related closure, the beacons are programmed automatically to coincide with school times, but they actually verify the fact that school was in session during that time so that the citations that are issued are actually valid citations. And then the primary thing is the ability to modulate, if you will, the number of citations so as not to overwhelm the system and process.
Thank you. Appreciate that.
Great. Council President Kritzer.
Thank you. I just wanted to issue a clarification for my comments, which is that I think we have certainly seen this quite a bit, and we've had a lot of discussion about it. But as I mentioned, I think we haven't seen the cameras will be at these locations at these times, and these will be the restrictions for each of those. And so I think just being able to walk through that, as well as if we're going to go out and do a survey to the public, we should make sure to take that into account before we make the suggestion. If we hadn't done the survey, then maybe we move forward with it. I do think that our council has given pretty clear direction to our staff that we want you to bring this to us and that we do want to proceed in accordance with our Safer Streets for All action plan, but the actual implementation of what exactly we're going to do, I think, has not been yet discussed, and that's why I'd like to see us have a study session. So, but I also won't unilaterally make that decision, so if other colleagues disagree with scheduling study session time, please let me know.
Councilmember Fields.
Thanks, sorry. I have my teams on, I'm just technically diminished. So since we're clarifying comments, I'm all about improving the safety of our streets and having drivers understand their responsibility to slow down, make sure that they're not distracted driving, that they're giving people enough time to get across the street, especially in our school zones. So I'm in support of the direction, and as Council President mentioned, we and Councilmember Stewart, we have talked about this. But I also feel it's extremely important that we are not a legislative body that ignores or does not give full due diligence to our community, and that's why I'm not against this, or I don't want anyone to think that I'm going back on statements that I've made earlier in these discussions. But I think it's really important that we understand why people maybe have objected. Maybe there's specifics that we can fine-tune this, or we can do better outreach or education. So back to the main reason that I'm not prepared to vote is because we have a body of information from our community, and we haven't had a chance to really look at it and discuss it and understand it.
Thank you. Yep, Deputy Chief.
Regarding the survey, where people are allowed to comment, most of the responses are they believing that it's just a revenue source for the city and not geared towards public safety. And that could be an education component we could do, as additional outreach once the cameras become operational, if not before. Per the RCW on this, the revenue must go to traffic safety initiatives. We don't have a choice in that. And And in previous surveys conducted by the city, there was an overwhelming concern from the respondents of people speeding and distracted drivers. And then my other, I guess for my clarification, if the results were, 60% against 40%, does that mean we're dead in the water and we don't do it? Or what are we gathering for the additional communication regarding the survey results?
Yep. Councilmember Fields and then Council Vice President Forsyth.
Yeah, if the council decides that this is in the best interest of the public good and increases the chance of us being successful in our safety goals, yes, we would consider what people said and what the magnitude or what the percentages are. But they're not elected to council. We are. So it's important information, but that would be a pure democracy. I don't think we're there yet.
I'm just going to jump in.
Council Vice.
Thanks. Yeah, I would agree. I think since we have that survey out there, we owe it to ourselves and to the community to look at that information. And if all of that information mostly says this, we think this is a money grab, then we educate and we have that ability to know that about what folks are saying and be able to communicate that out. I also agree with the idea of having this at a study session so that we can have somewhere to point to say, that the money has to go back into traffic safety. Here's where the cameras are going. If we very clearly lay out in one nice little presentation, then we can point folks to that conversation and show that we took their feedback and we heard their feedback and we deliberated and we saw how it fit into the bigger plan for our transportation management system and our Safer Streets for All program. I think we just owe it to ourselves and to the community to have a very robust process in making this decision.
Councilmember Nueva Camina. And then I think that will be the last question here. We're at 20 minutes.
Thank you. Just real quick, tying into Council Vice President Forsyth's comment and also Councilmember Fields is wondering, I see this as a beautiful opportunity to continue building relationships with our community, showing that we want to build trust, understanding that there has been previously a breakdown in that. So we've got a beautiful opportunity. And looking at what communication plan do we have, if we've got one, what can we put in there to say, hey, we hear you, we see your concern, we hear you, it's valid, and then Deputy Chief Coates, I'm bringing it back to what you had said about the educational piece of it.
So with that, the program and the law requires an education period. So for the first 30 days, and I would say I'd be willing to extend it to the first 45 days, it would be warnings for it. And as I had mentioned to one of the previous questions, we would socialize it with the school community. So prior to the start of school, that information would go out to remind, parents, family members, et cetera, that speed enforcement will be occurring, around the schools. We would also continue to use the city's communication channels as well as the police department's communication channels to push that out and educate the public. And in your packet, the report identifies locations where the cameras are going to go. The amended ordinance lays out exactly how the program works. So we have the anchor points or reference points that we can point individuals back to. It is heard that, we want to wait for the survey results. So we will find another study session. We'll come back and we will highlight or enumerate all those things and answer any additional questions so we can actually move forward, hopefully with this program to improve the safety, for our community.
Great. Thank you, Chief Lowe. I think we have our next steps is that we will wait for the survey data, be able to review that, and hopefully see this again soon so we can coordinate. I'll coordinate with Deidre on getting that scheduled. Our next agenda item is a FEMA subrecipient agreement with Seattle Fire. We have Fire Chief Adrian Shepard.
Good afternoon, Council. Adrian Shepard here, and with me I have Battalion Chief Caleb Freeman, and we come before you this evening. We have actually 4 items that we want approval for to move to consent on April 1st, and then we have 1 item that is informational. First one being our FEMA subrecipient agreement, and with that, I'll turn it over to Battalion Chief Caleb Freeman.
Thank you, Council. We appreciate your time tonight. Redmond Fire has been identified as a subrecipient on the SHSP, which is the State Homeland Security Program fiscal year 22 grant. The grantee is Seattle Fire, and we're asking for approval to enter into a contract with Seattle Fire to receive the equipment. To be clear, this is equipment only. There's no funds involved. And again, because it is fiscal year 22, it's already been allocated. The equipment is already been purchased, so there's no risk in the current climate with us not receiving this equipment. So we're looking at about $17,000 in structural collapse equipment and hope to get your approval on that.
Questions? Great. I think that this, Councilmember Stewart.
Yeah, thank you so much. Really appreciate you bringing this forward. My one question was actually about the temporal element. So this is for FY22. As you said, we've already received the equipment. Is this coming to us now because the paperwork has all caught up, or is this an item that we may have missed before? Just trying to understand a little bit more. Thanks.
Thank you for the question. Redmond has not received the equipment yet. Seattle Fire has. So we are getting the paperwork done ahead of time so that we can receive it. We're scheduled for late April or early May to actually take receipt of it.
Wonderful. Thank you so much.
Great, and this is for the April 1st business meeting. Any objections to it being on that meeting calendar? Well, great. That looks good to go. We will move forward to our next item, same group, acceptance of a grant in the amount of $400,000 from Washington State Department of Transportation for the purchase of an electric fire engine.
Absolutely, and thank you for this. With us remotely is Deputy Chief Mike Despain, and I'll turn it over to him.
Hey, good afternoon, council members. This item before you is pretty simple. We have been offered a $400,000 grant for help to reimburse some of the cost for the electric fire engine that we recently did the ribbon cutting on. But to accept the money, we have to go through council and have agreement to accept it. Then we'll enter a contract, which in your packet, you should see an example of the contract. We would sign the contract and then be able to draw those funds in. There's no matching funds. This would be simply to help reimburse us for the cost of the electric fire engine. And if it pleases the council, we would ask that this goes to the business meeting on April 1st also. With that, be able to answer any questions.
Any questions? Council President Kritzer and then Councilmember Fields.
So 2 questions. One is, as clarification, this is a separate grant from the other grant that we got for the charging infrastructure via Climate Commitment Act funds. Is that correct?
Yes, we received a number of grants, so this is just one of a long lines that we have been kind of working through. This one came late in the process, so we didn't get notified to this till late December, and it takes a little while for us to get it to this process to get council approved, but it's available for us as soon as we accept it.
Great. And in the contract, it mentions that the that the legislature appropriated $800,000, and then says this agreement is for $400,000. Was the other $400,000 to Bellevue?
That's correct. Yes.
Great. Thanks.
Councilmember Fields and then Councilmember Abikimina.
Yeah, I've read the agreement here. I don't see anything, but I would ask the question, is there anything in here that surprised you, a requirement or documentation or anything that you caught your eye that we should know about?
I know that's a good question. So when we first were entertaining the option of getting it, I wanted to make sure it didn't conflict with any other grant that we'd already received where it might diminish another one if there was any matching funds or any restrictions. And it's one of the easiest grants. It has the least restrictions of all the grants that we've gotten so far.
Great. I assumed as much, but I wanted to hear you say it. Thank you.
And that was the surprising part.
Sorry?
That was the surprising part.
Councilmember Nueva Camina and then Councilmember Anderson.
Thank you. And that was actually my question was very similar to Councilmember Fields, was after I'd gone through making sure, because it was so easy, looking for any stipulations or restrictions that I may have missed. But thank you. You already answered that.
Great. Councilmember Anderson.
Thank you. I didn't see this in the packet specifically. Could you clarify if this is also funds that can be used to cover staff time?
No, this would be specifically for the reimbursement of the cost of the electric fire engine.
Okay, equipment only?
Equipment only,
Thank
yes.
you.
Great. Any other questions, comments? Perfect. Well, looking forward to seeing this on the April 1st, or any objection to seeing it on the April 1st agenda. Seeing none, we will see it then. Thank you. And then passing it back to you, Chief Shepherd.
Absolutely. So item number 3 is our Microsoft donation approval, and I'll hand it back to Deputy Chief Despain.
Thank you, Chief. This is the next one, and this is a donation that we received from Microsoft, again, for the electric fire engine. No matching funds, no restrictions. It's simply their commitment to help with the program that we've tried to push forward following the council's direction and the mayor's direction and the fire chief's direction. So we just need approval to accept the funds and put it towards the electric fire engine.
Questions here? Seeing none, any objection to seeing this on the, I believe it's also April 1st consent agenda? Great, we will see this then.
Thank you so much.
Next item, thank you. Next item is city resolution to renew King County Medic 1 EMS levy 2026 to 2031. I believe we have a whole team joining, so I'll pass it to you, Chief Shepherd.
Absolutely. Thank you again. So this is the Medic 1 EMS levy update. With me this evening, we have MSA Amy Moorhead and Director Michelle Plord.
There we go. Hi, can you hear me okay? Thank you for allowing us to come and share what we've been working on for the last year to ensure that our Medic 1 emergency medical services is allowed to continue uninterrupted until the next levy period. So I've prepared a couple slides, and I might go through them quickly, and it should be included in your packet. So because this current levy period expires at the end of this year, that prompted sort of regional leaders to come together and say, okay, what do we need to do in order to be able to make sure that that is continuous into the next levy period. So we had an 8-month intensive process, mostly during last year, that was overseen by the EMS Advisory Task Force. And what I liked about it is it gave us an opportunity to really dive deep into any issues that people had, any community ideas that were being raised, and to debate and get consensus around what our plan would be going forward. So I really liked that process. As mentioned in the staff report, it is required for us to go and get 75% approval by the cities over 50,000 and the King County Council before we can put this on the ballot. And so you are one of those cities. There are, in this case, in the King County, there are 11 cities, so we have to get 9 for sure. I like to go for all 11. And so I'm doing this around the county, giving this presentation. Let's see, I'm gonna go here. So just a real briefly, some people aren't sure what Medic One is, but anytime you call 911 for a medical emergency, you're accessing that system. And just for some stats, let's see if we can get rid of that. Yeah. We serve over 2.3 million people, go on a call about every 2 minutes. Yeah, we lost our. Got frozen here. Still on there, yeah. Sorry. You can't see it, but we can. So still not going. Yeah, we can just, you've got all the presentation. Can't forward it, that's the problem.
They have it, you can go.
All right. You have it already in your presence, so I'll just get rid of that and move from my, I'm glad I have this. So we go on about 250,000 calls region-wide per year. One of the things that we track regularly is our cardiac arrest survival rate. That is a gold standard for measuring the quality of an EMS system. And in 2023, our rate region-wide was 51%. That's pretty phenomenal if you compare it to other places that it's about 2 or 3 times higher than the average city around the county. And so we're really proud of that fact. So why does our system work so well? And one of the reasons we believe that it does is for several. One, that we are a region. There are many, many different departments, hospitals, other people who rely on our system, and we believe that we work better together, that when we come together, our outcomes are better than if we or there's some of our parts. The other thing mentioned in the staff report is this concept of a tiered system. We reserve our paramedic service for just the very most acute, most life-threatening calls. Our BLS, which is our layer that the EMTs go out, they go to all calls, and our paramedics only go to those high acuity, and that's what constitutes our tiered system. We believe that in equity, that every person in our region deserves that highest quality, and we really attempt to offer that to every single person who calls that us. And we also use innovative strategies. We have partnerships with the University of Washington and Harborview. We're constantly looking for ways to improve our protocols and our practices out in the field. And lastly, we are funded by an EMS levy. And that has proven during the good times and the challenging times financially to be there and to be solid and to be reliable and cover our costs. So I wanted to share a couple of the key factors that we considered when we were deliberating these past 8 months. And one of the factors is our growing population. As you know, and you can see from this map, that our community has grown significantly over the last couple decades. We're up to 2.3 million, which is the last couple decades has been an 18% growth. It doesn't account one-to-one for our call volume increases, but it certainly plays a role in understanding and anticipating and planning for the next levy period. There's a couple slides in here that I wanted to share about diversity and why it's important to us. So you can see in the green graph to the left, it's looking at population growth. And you can see that there's incredible growth over the last couple decades in our communities of color, particularly the Asian and Hispanic. And if you looked at the map before, you could see that Redmond has incredible growth itself, and so we're taking that into consideration. One of the other aspects that we looked at is looking at the residents that are born outside the United States. That percentage is also growing, and you can see that in the graph to the right. So during our, yes, there we come along. During our strategic planning process, again, I mentioned the EMS Advisory Task Force. It was made up of 20 elected officials with representatives from all the 11 cities over 50,000. We also had 3 seats for the Sound Cities. Fire commissioners had representation, and then also a couple seats for the King County Council. This was chaired by the exec's office, and part of the structure was to have also 3 subcommittees, one for the paramedic program, one for the EMT programs, regional services, and then finance. Mayor Burney was the representative for the city of Redmond on that task force, and we appreciate also that she did extra work by chairing the regional services subcommittee, and so we appreciate her commitment to our process here. One point of clarification, and you'll see that as we go through the rest of the slides, is that since the beginning of our regional levy, which was in 1979, the city of Seattle has received the funds raised in their city, and then they also manage it separately. So when we're talking about the programmatic aspects of the recommendations, that's for outside the city of Seattle, but we will bundle it all together for a full funding package once we get to the end of the presentation. Let's see, why don't you go ahead and go to the, we're a little ahead. So before we go into the recommendations, I want to ground you in the current levy period. From 2020 to 2025, we're in a 6-year levy period. The starting rate at 2020 was 26.5 cents per $1,000 assessed value. It's expected to generate by the end of this year about $1.1 billion. And for the part outside the city of Seattle, we have funds that go to support entirely the medic program, including the medic program here in Redmond. It contributes to the fire departments in the region, and because they have other sources of revenue, but it also funds both the reserves and regional services and strategic niches 100%. The cost to a homeowner in 2020 was $159 region-wide, and in the city of Redmond, based on an $855,000 average home, it was $227 per person per year, or I should say per household per year. Let's see. One of the things that I wanted to mention for the task force recommendations is, again, the programmatics was outside the city of Seattle. And so for the ALS subcommittee, they recommended 3 things. One is to continue using the allocation for how we reimburse or pay for the Medic One service in each of the 5 jurisdictions at ALS cost plus CPI W plus 1% as an inflator. They also recommended putting a placeholder during this levy period so that in case we had increases to our demand that went beyond our capacity, that we had an ability to add at 2 different points a 12-hour medic unit. The third recommendation is also to make sure that there's sufficient reserves and contingencies to cover ALS programs if they went outside their unit allocation. The second subcommittee recommendations were for the BLS subcommittee, and they recommended increasing the total BLS funding by $5 million starting in the first year, split between the basic allocation of $3 million, and then also supporting at $2 million starting the first year of our MIH programs, which is the Mobile Integrated Health. The thing that's unique about that Mobile Integrated Health has been able to offload some of the pressures on the fire departments to go out and respond to some of those low acuity calls. So the region really supported this extra funds to MIH. They also supported a CPI increase at CPIW plus 1%, and then doing a slight adjustment to the distribution for funding for the formula from 50-50% between calls and AV to a 60-40 split. And then lastly, they wanted to support the mental wellness and the equity and inclusion efforts of the King County Fire Chiefs Association. All right, the last group of programmatic recommendations was our Regional Services and Strategic Initiatives Subcommittee, and they recommended continuing the current existing programs that have been supportive around the region, including medical program direction, data collection, and training of our EMTs. They also recommended enhancing a couple of areas, one with the increased staffing needs and training. They wanted to support, in addition, initial EMT training expansion, and also renewing the telephone referral program, which also takes pressure off of our first responders. And then the third area was to maintain a couple of the strategic initiatives, one being the community-based partnerships, or ECHO, and then the second one, which is our data systems improvements, which is our PRIME program. And then they also supported a third one, which is new, which is to do technical improvements to our emergency medical dispatch programs. All right, so if we get to the pie chart slide, it gives you an idea of the proportionality of those funds. So, of course, the majority of those funds go to our ALS program, or paramedic programs, followed by the BLS and then regional services and initiatives. Up in the green graph, you can see the dollar amount for each of those, totaling $919 million. And then I've included what would come to Redmond for both the ALS program, which is fully funding the medic program, and then the BLS program, which partially funds it. And it's estimated, its current actuals for 2025, and then estimated for 2026. The fourth and final subcommittee recommendations, these were all supposed to very elegantly come sweeping in, so it's not going to be as coordinated as or choreographed as nicely. The first two really have to do with what they started with, which is they recommended risk analysis be done, particularly around some of the factors that are included in both the side of revenues but also expenditures. And then their second recommendation is based on that analysis to come up with sufficient reserves that would cover that risk. And so some of the main drivers on the revenue side is, of course, what is the AV that's determined at the first year of the levy, what new construction levels are throughout the levy period, what's that split going to be between the county and the city of Seattle, and then sort of a revenue side, and it'll tie in when we're looking at our financial plan, is how much money out of this levy period are we able to carry over into the next levy period. Some of the drivers that are in the expenditure revenue side include the number of units that we have, what the cost per unit is, what are the cost escalators that I mentioned, inflation, and then if we're going to add any new units and or enhance any of the services. So you can see in the graph that the ones that they chose to focus in on had to do with AV and whether we can project that accurately, what the new construction would be, what that split between Seattle and King County is, and then, of course, the inflation. What the graph shows you on an individual basis is the minimum maximum risk that they showed, but for me, the most important thing is to look at that cumulative, which is that risk analysis range that's identified at the bottom of the slide. So if you want to sort of put in the back of your mind that minimum of 31.8 million to the worst case scenario, which is of the 76.9, that will be coming in the next couple slides of why that's important. So the next slide shows you the full packet all put together, and I'm going to run through it for you in a little bit of an unusual way. Total expenditures, when you put all those programmatic things together, and again, this includes the city of Seattle, total expenditures come to about 1.4 billion. The reserves that are for programmatic and the required rainy day King County reserve is 67.7 for a total expenditure amount of 1.5 billion. Then we are able to estimated carry over $64.4 million King County also has, outside the city of Seattle, some revenue funds, mostly interest. And then at a 25-cent levy rate, we are able to raise raise $1.47 billion for a total of 1.55 in revenues. The thing that that allows us to have is this 47 million in reserves, supplemental reserves, and that number falls right in the middle of that range I was talking to you about, between 31 and 76. And the financial subcommittee felt like that was a comfortable place, that the likelihood of every single one of those coming out at a max risk was unlikely, and that being right in the middle is a good place to be, particularly with a program that relies, the community relies on it so significantly. So in summary, the last recommendation that the financial subcommittee made is to take that 25-cent levy rate, the $1.5 billion revenue, and to give that to the EMS Advisory Task Force for deliberation. So I'm going to skip to the very end, which is the task force, in summary, supported those programmatic recommendations. They recommended a levy rate of 25 cents. The average cost to a homeowner is $212, estimated based on an $850,000 home. They supported a levy length of 6 years, which would cover from 2026 through 2031. And then finally, they supported ballot timing of on the general election in November of 2025. So I think I went through those pretty quickly. If you have any questions, happy to entertain those. Yes.
Great. Councilmember Nueva Camina.
Thank you. My question is, with City of Redmond, we're in a very unique, perhaps not so unique, because there's several of the cities that are experiencing exponential growth right now. In the City of Redmond, we're currently ballpark about 80,000 residents, and over the next 10 years, we're looking at growing by another 30,000. Now, since we're not going to be adding to single-family homes, that's going to be very dense living, which means a lot of apartments, which means not homeowners. Is that number that we're going to be increasing by renters, has that been factored into this? Because the numbers are based off of homeowners and also addressing the growth. So is that one of the factors inside the equation?
So we don't look specifically at apartment buildings because, or the people living in them, because they, those apartment buildings, they also pay property taxes. So we look at the total amount of what's estimated to be raised during that period of time based on all these other factors that we were talking about and include that in our assessment. So the way I look at it for an individual person is if I live in an apartment building, built into my rent is a coverage for those property taxes that the apartment building or other facilities have, that they also have to pay property taxes.
Thank you for the clarification, because that's what I was getting at, was that it specifically says homeowners in the presentation.
Yes.
So then that allows for the question of what about residents that live in apartments, and then what is the tax that the property owner is making, such being whether that's a national firm or a local developer.
Very good point. We should talk about that. Yeah, very good point. Thank you.
Councilmember Fields, and then Council President Kritzer.
Yeah, thank you. So my colleague, Councilmember Nueva Camina, asked about the risks associated with revenue, and I appreciate that. I was going to ask that question. Appreciate the answer and the candidness. But I also, everything is a prediction. Everything's an estimate, right? And that's always scary stuff. It's a risk. So I would like to understand what you see, or what the group discussed with respect to risks in estimating expenditures. And as an example, you mentioned the increasing diversity. And I'm not really sure whether that, if there's issues, programmatic issues that drive the cost up, such as language or something else, or maybe it brings it down, I don't know. But what, in overall, what would make you nervous about your estimates on expenditure increases not being on the same, or being higher than the revenue predictions, especially because we're in a medical world. And we know that it's pretty, I don't know, unpredictable.
Yeah. Well, that's a really good broad question, and I've been working in the EMS division for it'll be 29 years, and so I've seen a number of different cycles of us going through good times and bad times. So one example I would give is during the 2013 levy period, started off with, the drop in AVs. And so the thing that's very elegant about how we do our revenues and our expenditures is typically, especially around property taxes, that when those go down, sometimes inflation will counter that sometimes and allow us then, and again, if you're looking at the calculations, our expenditures come down a little bit under the predicted 6-year financial plan. And so that takes a little bit of relief under what we've projected out for our revenues. So it's one of those things that balances out really nicely over time. And then, of course, after the first year, if AVs go through the roof, we don't stay at that high level of the rate. Our rate goes down. So for example, in this levy period, started out at 26.5, but we're now at 22 because we go based off our 1% increase in new construction. So there are a lot of balances in our financial plan that allow us to sort of stay within a very comfortable place. And part of the reason why we have so much carryover is because we haven't had to access those reserves. And so $64.4 million is coming over into the new levy period. And so again, that's where our comfort zone is that if we have little shifts that we need to make during the levy period, our financial plan allows us to stay within a certain range, and then our reserves allow us to have a little bit of wiggle room. So to be honest, when they've done their calculations around their risk, I feel very comfortable that we have some wiggle room.
Good.
Yeah.
Got it. It sounds like the length of time helps because you have the ups
Yes.
and downs. Sounds like the law of large numbers. It sort of smooths out over time.
And I don't often talk about that one point, which, because it's sort of an arcane little thing, but I'm a huge advocate of the 6-year period for a couple reasons. One is, we use data a couple of years before we start this process, 2 years in advance of the expiration. And so when we're using some of those calculations, that ends up being over a longer period of time. And then in addition to that, we have an authority to do a 10-year levy period or a permanent one. And so I love this 6-year period because it gives us, relatively reliable and smaller ranges. I can't even imagine what that risk range would be if we had to do a 10-year or even I don't even know if you could do it on a permanent. The second reason, and I go back to one of those value statements that we made earlier on about our regionalness, is that we bring all these partners together and talk about things that are up and coming, so we feel very on top of trends that are coming, population changes, our changes in our community, needs of our community. That's where the Mobile Integrated Health Program came from, is because we were seeing a lot of low acuity calls and we didn't know what to do with them. So we started some pilots around the Mobile Integrated Health. One of the pilots that is up and coming this year is in response to the opioid crisis. So the Medic One program, the paramedics are going out and offering buprenorphine starting on April 1st. And then in this area, we're able to connect them into Crisis Center in Kirkland. So it's a wonderful way to be able to cycle back and bring issues forward without being really disruptive in our financial planning.
Great, thank you. And I think it's helpful to point out that we did have a pandemic during that recent, 6-year period. So,
yes.
Small question, if I can, Chair, just a very quick question.
Yep.
Is there any impact on this program on personal insurance? Like the success of this program, does that mitigate people's health insurance? Or I can't come up with a reason for property insurance, but is there anything at all in that we provide as a benefit to people who go out and get health insurance? In other words, is personal health insurance less because of the success of this program? I get.
That's a good question. I haven't really thought of it that way because I think of this program as an insurance in itself. There, everybody pitches in to their ability based on the property, and they're allowed to call anytime. But you also have to have your personal insurance because.
I'm thinking of this fictional benevolent actuary going, they have a really good program in the King County area. We shouldn't charge them so much for health insurance. But
Wow.
am I dreaming? Yes.
Yeah. You see a source on that, let me know.
Great. Council President Kritzer.
Thank you so much for coming to share this and for all the work that's gone into this. Really appreciate it. I'll note, I think you mentioned mobile integrated health, and I know in our city that has been a huge game changer in terms of being able to address chronic needs and having that follow-up. And we've invested additional resources of community care coordinators that can help to support with casework like that because we've seen it be so effective. I'll also note, I think for me, looking even at, as we look at the cost to the homeowner, just to call out, if we think about, let's say for $1 million home, maybe it'll be more like $240 or something, right? Break that down monthly, that's like $20 a month to get access to this whole suite of emergency services. Seems like a pretty good deal to me, even though obviously we do want to be thoughtful about every kind of tax increase and what that burden places on people when we think about what you get out of it, and compared to, say, having to pay for other types of insurance for who knows when you'll use it. But in this case, we all will have access to this, which I think is really wonderful, and it integrates so well with our emergency services. I guess one question, the one question I have for this is in terms of what you're asking us to do. So we would take a vote to basically recommend the county council adopt this. If we wanted to take a position later on the ballot measure, once it gets kind of put onto the ballot, would we do an extra process to be able to have taken a position, or would that count as our city's position as endorsing the ballot measure? Because I know typically with ballot propositions, we go through a separate type of process to endorse something like that.
Yeah, so we're not asking for an endorsement because that would look like a campaign sort of related issue. So what we do and what we're required to ask is that your support to putting it on the ballot for the voters to approve. We haven't transmitted this this plan to the King County Council yet, so today we're just doing a presentation to you, and once that is transmitted, then we'll come to you for that more official motion to put this, the resolution on the ballot. Yeah.
Great. Thank you.
Does that answer your question? I think.
Yeah, actually, well, can you clarify then what the timing would be for us to actually take a vote on recommending to the King County Council or supporting them putting it onto the ballot?
Yeah. Okay. Helen, do you know the? It's in August, but I can't remember the exact date. Sorry, this is Deputy Director Helen Chatalis.
So you're asking by what date you would have to make a resolution? Is that what you're asking?
Yes, thank you.
You could probably do it as soon as the beginning of May, but no later than July, beginning of July.
Great, thank you very much. I'm in support.
Great, and we're at 5:31. Councilmember Stewart, if you can ask a quick question, that would be great. We have one more item after this, and then we can check in on if there's any objections on this. So, Councilmember Stewart.
Thank you. No questions. I support moving this item through and supporting the levy as proposed for this particular ballot. Also acknowledging that our county partners are juggling a lot of ballot initiatives and levies in the upcoming year. And so keeping the timing on this one stable is also important for our city. So thanks so much for being here tonight.
Thank you. Any objections to seeing this on the April 1st consent agenda? Great. Really appreciate the presentation, and we will see this on April 1st.
Thank you so much.
Final item, actually, council, are we okay going a few minutes over, maybe until 5:40? Oh yeah, Council President Kritzer.
I would suggest, I had noted this when I saw the agenda, I think I'd sent an email to you and others, that I think this last item, we have 24 slides. It's covering the entirety of 2024 fire prevention performance data. It feels like it could be a really great one for a staff report if we wanted to give this a little bit more airtime rather than kind of rushing through 24 slides at this committee meeting. That'd just be my suggestion, but up to the rest of the council on where they stand on that. And I do want to respect that the staff is here to do it.
I'm flexible with that. I would pass it to Chief Shepherd on how he feels with his staff there as well.
Absolutely, thank you. It's certainly at your pleasure, so we're more than happy to come back per your suggestion. Probably getting some mean looks from the people behind me, but more than happy to do so, come back at a later time.
Yeah, that sounds great to me. Any other, Council President Kritzer?
I'd be happy to work to get this onto an agenda soon so that we can see this. But I do think it would be great, actually, if we could present it at maybe the next business meeting as a staff report, so that way, or special orders of the day, so that way we could just be able to hear, have the whole community hear about all the great work that was done all last year by our fire department.
Really appreciate that. And thank you, Council President Kritzer, for working to get it on the next business meeting. Any other questions or comments on any of the items that we heard? Perfect, and thank you for your flexibility, Chief Shepherd. We have reached the end of today's agenda. Is there anything else for the good of the order? Seeing none, we are, Council Member Stewart.
Thank you so much. Just quick shout out and thank you so much, Chief Lowe, for sending over the information. Just for the listening public, the City of Redmond is hosting an event on April 19th. The intention of the event is to help residents find a way to dispose of unwanted or possibly improperly stored firearms in their homes. So April 19th is the gift cards for guns buyback event happening on the north parking lot at the Public Safety Building from 9 a.m. to noon. Thanks.
Thank you for that note, Councilmember Stewart. Well, great. If there's no other items for the good of the order, we are adjourned.